perfect prompt and reminder. I think we can go ahead and get started and people will jump on. We'll start with introductions of the work group and then most of the bulk of the conversation will be towards the end. But thank you so much. Good morning, everyone. Thank you for joining our webinar. It's focused on caring for our Russian and Ukrainian families. So considering the context and the impact of COVID and the context of the external war, we thought this conversation was incredibly important to have, especially with pediatricians and especially after the webinars that we were able to have within the community. So we'll dive into our agenda and a bit about what we worked on with this grant. And then we'll have plenty of time, hopefully, to have a conversation at the end. So I'll start by introducing the incredible stakeholders, partners that I've had the opportunity to work with on this initiative. We'll talk a bit about what we did, the 2 webinars that we had within our communities, one in Russian and one in Ukrainian, some of our key learnings. We'll talk about some resources to share with you all as providers, including a provider training from DOH, if you haven't heard of it. And then really want to give 30 minutes really with Dr. Odarich, our incredible community family practice provider who sees a large majority of Russian and Ukrainian patients within her practice in Sunrise. I believe that's in Happy Valley, Dr. Odarich? Yes.
Yes.
Perfect. So much better than I can do introductions, I'll let each of our work group members introduce themselves, say their name, their role, and either your connection to the Russian Ukrainian community and your involvement with this grant. So we'll just go in line and start with Irene.
Good morning, everyone. Thank you for making time so early in the day. My name is Irene Konev, and I'm here as a consultant with Konev Consulting. I've been involved in community outreach for 20 plus years, and it has been a true honor to work with this group and the community. And my role was to create the outreach strategies and reach the community. And I worked really hard on reaching the community that is generally unheard from. And so for our surveys and participants, we try to reach the community that doesn't get to share their voice all that much. And I also reached out to 2 families who shared their stories to center our webinars. Thank you.
Thanks, Irene. Vadim G. We have 2 of them on our team. Oh, I think he's still joining. Vadim K.
Sure. So my name is Vadim Kogan. I'm an immunization health educator at the Washington State Department of Health. I'm the project lead for the FSU vaccine outreach project. We've been doing this vaccine outreach now since 2019. I'm from the community. I'm a refugee originally from Moldova. My mom is from Ukraine. So I've had the chance to work with this community now for a couple of years. It's been really rewarding work. So we'll be talking more about some of the resources that the Department of Health has developed that you all can use in your work with the community later on.
Thank you, Vadim.
So I'm Tatiana Darich. First of all, thank you so much for spending your morning with us. I'm family physician. I actually finished my education first time in Ukraine and had to become pediatrician, but moved here and graduated from OCSU here. Went to residency at Peace Health in Vancouver, Washington. Worked for quite a few long years in Vancouver clinic. And then I opened a practice with another physician. So it's 2 physicians practice. We are both from Ukraine and all our staff speaks Russian, Ukrainian, and English. So it's a small kind of culturally targeted clinic, but of course we see everyone. So I would say approximately 40% of our population is from or Ukraine majority or Russia. And I'm happy to be there with you and here with you.
Thank you, Dr. Darch, and we're so glad to have your expertise here on the line. Dr. Luha?
Sure. Good morning, everyone. My name is Sering Leva. I am a general pediatrician with Child and Adolescent Clinic in Southwest Washington, and get to take care of a good number of Russian and Ukrainian-speaking families here in our area. I'm also a trustee on the board of the Washington chapter of the AAP, and had the privilege of serving as the pediatrician advisor on this project and work with this amazing group of people.
Great. So as you can tell, lots and lots of expertise on the call. Very fortunate to be able to work with this incredible group of partners on this project. My name is Tammy Martin. I've been supporting as a program manager on this project. I am part of the Romanian community, so familiar with the Eastern European culture and Slavic communities, and very passionate about this work. So we'll start with a very quick overview of our project and our initial scope. We received a grant from the AAP National, and our initial focus was increasing vaccine confidence in the Russian and Ukrainian communities, specifically in Clark County. And this population and county was chosen prior to the war and was decided specifically based on the measles outbreak and high unvaccination rates in that population. Obviously, there was the war that started, and we had to have a crucial conversation on what is the scope and what is the need. Do we pause this grant? Do we still have this conversation? I mean, we do not want to burden a community that is already burdened with so much. And with my conversation with the community partners that we have already introduced on the line, we realized the conversation still needed to happen, but what we needed to have was a space for community trust, questions, and a safe place to get information. So we really revised the scope, and we appreciate the partnership with the AAP to revise our focus of the grant to host 2 webinars, one in Russian, one in Ukrainian. And we framed it more as Ask a Doctor. This is a resource for you to have conversations with Dr. Odarich, a family practice provider, to talk about the trauma, to talk about both the trauma from COVID, from the war. And I think, and our group probably agrees, that initial scope and that initial trust that we're building with this type of webinar will help us be more effective when we want to focus on vaccine confidence. But it's that first step of really building trust in the communities and being able to pivot and make sure that we're providing what's actually needed. So here's an example of our flyers. You can see Dr. Darch over there on the bottom right, and we translated both the flyers both in Russian and Ukrainian. We worked with community partners. Irene was great connecting us with the Slavic radio, emails, newsletters. We used Facebook, and it went, 300, 400 likes, and was really able to get the word out, specifically because the webinars were in Russian and Ukrainian. So they were in the native language. We were targeting a very specific population and wanted to make sure that this resource was properly advertised for. And then quickly on the webinar format, we started with sharing our purpose and agreements. We didn't want it to be a political webinar. We really wanted it to be a resource for the populations that were there. We held it in the native language. Dr. Darich was great and was like, let's not have a slide deck. Let's really have an open conversation, an open dialogue. And that's really what it was. Irene found incredible community partners to start off the conversation. So we invited a family member, both from the Russian community and the Ukrainian community, to share their story and really start that dialogue, and was able to start the conversation with what their experience was, either from the trauma of the war or their experience through COVID. And really the majority of the time was spent answering community questions. So these were the 2 webinars that we've had so far. We're hoping to share some of our learnings from these webinars and also have a conversation with Dr. Darich about her expertise and advice working and caring for Russian and Ukrainian families. We also wanted to have a quick conversation about the importance of this. Why is it important? So Dr. Lua, I'd love for you to kind of speak on that as a pediatrician and from that perspective.
Sure. Thank you, Tammy. I also just see Vadim G, and I'm wondering if Vadim G would like to introduce himself as well, and then I can go into the slides.
Absolutely.
Good morning, everybody. Sorry for the tardiness. One of those things where I woke up not realizing I didn't have internet and took a scramble to get everything together. But my name is Vadim G. I work with Vadim K in DOH, specifically focusing on FSU communities and the outreach that we conduct there. I help translate web material and get other languages up on the web as well. So that's kind of my area.
Thank you.
Thank you. Before I discuss the slide, I also wanted to briefly acknowledge how great it's been working with an amazing group of people on this project from the beginning, with Sarah and Ariana securing the grant for us, Tammy coming on and doing a fantastic job of organizing, adapting, and running our preparatory meetings and making these webinars possible. Irene, Vadim K, Vadim G, for all your expert advice and for helping us in so many ways. And of course, Dr. Odarich, for all your wisdom and compassion as you led these webinars in Russian and Ukrainian for our families. So I wanted to share why we all as pediatricians and primary care providers need to learn more about our Russian and Ukrainian speaking communities. As we all know, Washington State is home to a large, diverse, and growing immigrant and refugee community. According to the American Immigration Council in 2018, non-US born individuals made up around 15% of Washington's population. And another 15% of the state's population were native-born Americans who had at least one immigrant parent. So this number has been most likely been increasing over the years. Eastern Europe, including Russian and Ukrainian-speaking countries, is among the top 3 regions of origin of immigrants in Washington state. Unfortunately, our Russian and Ukrainian-speaking communities have low and decreasing immunization rates, as you heard, children being significantly less likely to be vaccinated for all childhood vaccines compared to the general population. Although I don't know of any specific studies myself, based on observations, noticed lower well child and preventative care visits as well. And as we will learn, there are many factors, including historical reasons for mistrust, language and cultural barriers, among others. And all this is contributing to higher risk and negative health outcomes. An example is the COVID-19 pandemic and how it's greatly impacted the communities. From January 2020 till May of 2021, hospitalizations and death rates from COVID-19 were disproportionately high, around 2 times higher in these populations compared to the general population. And of course, as you heard, the ongoing war in Ukraine is a source of significant distress and health concern for many of our families here. So all this makes it even more important and urgent for pediatricians and other healthcare providers to learn more about these communities and how we can better serve them through increased understanding, through having meaningful dialogue, removing barriers, and building trust. Thank you.
Thank you. And that's such incredible context, and the importance cannot be more understated. Before talking about resources, we also wanted to share some of the feedback that we received from our participants. We had about 15 participants at each webinar. And as Dr. Luau said, trust is a challenge within this community. When we surveyed our participants, they agreed 83% with the statement, "You can trust providers in our community." 17% neither agreed nor disagreed. And really something to think and, consider is how can we continue building and facilitating that trust, whether that be one-on-one within the clinic, whether that's creating these webinars and offering resources. It's really something that's top of mind for us in this work group. Something that was encouraging was that participants were more likely to seek out health interventions, or they stated that they were more likely to seek out health interventions after this webinar / conversation. So in this, the question was stated, will this affect your decision about child health, whether that be seeking out care for trauma, fear, vaccines, preventive health? And we're very encouraged to see that almost 90% said that they were more likely to seek out health interventions. And we're probably feeling that they were even more informed. And then finally, there were lots of other conversations that this community wanted to have. At the end, we had an open conversation or an open response bubble. They wanted to learn more about stress, PTSD, mental health, specifically vaping and homelessness within the child and adolescent populations. So there are continued conversations and a hunger for these types of conversations with the community. So we want to give time to talk about resources and then have Dr. Dart speak. Irene, we connected with so many great community organizations. I'd love to have you kind of speak to that and your experience with the grant.
Yes, I didn't share earlier. So my ancestry is Ukrainian and Russian, and because of the understanding of what the community, where the community is coming from, and what are some of the barriers that face the community, I was able to do this kind of outreach, and I started doing COVID outreach, addressing masking and vaccine hesitation. And so when we began to build out this outreach for these webinars, I was already connected to like the IRCO, the Slavic Eastern European Center. I was working closely with Vadim and the other Vadim on the Department of Health Office of Immunization and Prevention. I've been on Slavic radio with Dr. Adaric sometimes, and with Dr. Ryan Hassan, who's here with us today, talking about COVID and putting articles into the Fisher magazine, the newspaper, and then a more recently formed nonprofit that Andrei Nagorny has created. It's running now, and it's helping people who just arrived from Ukraine to kind of figure out how to settle in, and English language and a whole bunch of other resources that he's providing. And additionally, for the last year, through a grant from DOH, I've been working with Clark County, and we've been running a Slavic health board working group to establish a health board for the Southwest region of Washington. And so through all of these connections, many emails, many calls and texts, and however I was able to reach the community, I was very honored to be a part of this team.
Thank you, Irene. And we couldn't have done it without you. And then we'd love to have Vadim G and Vadim K talk a bit about the provider training and then other online resources that are available.
Yeah, I can talk a little bit about that. Actually, Tammy, I didn't get a chance to send this to you. This DOH just put up a website. It went live late yesterday for Ukrainian arrivals. So it was our refugee health director had put this up. So I'm dropping this website in the chat. And that's just a list of resources that are translated in Ukrainian and Russian for recent arrivals coming to the US from Ukraine. So feel free to take a look at that link. Aside from that, we'd put together a training with Reach and some of the people here as well on fostering COVID-19 vaccine confidence in Russian Ukrainian speaking communities. That training gives continuing education credits to providers serving the community. it is definitely worth looking into if you haven't taken a look at it yet. We're currently in the process of updating the course since it was developed last summer. It does talk about cultural considerations of the community and then also best practices in terms of how to do vaccine counseling with the specific concerns that community members here have. And it was a partnership between providers that serve the community as well as community members and community leaders themselves. Yeah, Tammy, I think there's one more slide now. And then this is a list of online resources, some links on talking to kids and teens about the current conflict, and then some others on vaccine hesitancy. That online course also includes a listing of resources there as well for COVID-19. And the link that I just shared is actually got the most recent resources that we have. So I would say, since that website just went live yesterday, definitely worth taking a look. It'll be updated consistently with new information as it comes out around the conflict and Ukrainian arrivals and resources that are available to them.
Thank you, and perfect timing. Vadim G, did you have any?
One thing I would add is with constantly developing dynamics such as what we have here, an important thing is to make sure that you're up to date on the newest information. And so what we have here is just some of the most high quality pieces that we've been able to locate. And so really great articles, grievingstudents.org, healthychildren.org, really topical and highly specific articles regarding how children react to conflict and how just how the dynamic works. And I'd really encourage everyone to read, and even people who are not at all associated with helping children or adults or in any medical way. Great things to know about the current state of our world. And then the EAP right at the bottom there under the online course is also a great resource, just kind of giving definitions to some of the terminologies and some of the organizations that are also concurrently helping and trying to strive to improve the situation of both immigrants and refugees and Russian, Ukrainian speaking individuals in general. And it's kind of important to know that there are other people and other organizations helping, and so we're not siloing and hopefully helping each other in that regard. So yeah, these are some of the greatest resources we found.
Absolutely. Thank you so much for sharing. And we will be sharing the slides out, and the links will be on there as well. So we did it. We have 30 minutes for the open conversation with Dr. Odarich, which we did want to give time to. And Dr. Odarich, we'll give it to you.
All right. Well, good morning again, everyone. So I was thinking when I was thinking about this webinar, how in the world am I going to tell pediatricians how to take care of kids? So this is not my goal, first of all. And I also don't like lectures, as I imagine many of you. And morning is a tough time for lectures to begin with. So I will give introduction, some thoughts. It's biased, I can tell you right away, because everything I'm going to tell you is from my experience and experience of my patients. It's not from some kind of textbook. So I leave right to be wrong sometimes, but also I hope to have opportunity to discuss together how we can work with that. And of course, my goal is not tell you about what was, what problem with vaccination we have, all about it. So I will just give a little bit of historical background, cultural background, and differences in the United States and barriers that are very sad for all of us, I think, in medicine between us and patients. And unfortunately, at this point, we have so many walls between us and patients that it makes very, very difficult to build rapport, trust. Somehow expectation is that physician can build trust in 10 minutes of visit that we have, plus lack of continuation and of care and so on. So some of it will be very emotional, so I apologize in advance. But let's just go. Let's just get started. So first of all, history. So history of your particular population might be slightly different. because I am telling you from experience of Portland, Oregon, and Vancouver, Washington. And actually, even here, immigration is not the same. So I don't know what kind of immigration you got there, immigrants. A majority of immigrants here are, they immigrated by churches. So it's usually Protestant churches. We're talking about humongous organizations of 10,000, 30,000 people. And those are people who do not vaccinate. And right now they're going through very difficult time when they basically break on two different large categories of churches, churches who support Ukraine and churches who support Putin's war. So right now it's a very difficult time for that population. And we also have not too large population of Jew people, and that's usually people who are highly educated, vaccinated, highly integrated in community. So usually we don't have like much difficulties in terms of bringing our message to them. So this is to begin with. So it depends what kind of background your immigration population has. History will slightly differ, or not so slightly differ. And then in terms of background, where people came from. So I can tell you as a person who was taught there and here, that system is extremely different. First of all, in former Soviet Union, and still, I would say majority of Ukrainian, I don't know anything about other countries, so I will tell you about Ukraine post-Soviet. Majority of physicians work for government. And that is a very important point here, because basically reputation of government directly affects reputation of medicine. I know it's similar here now, which is relatively new experience for me here to be responsible for government decisions that I never participated in, but it is a direct connection in Ukraine, because actually government pays money to physicians, or doesn't pay money, pretends it pays money. And then another part of it is that people can pay own money to physician for wherever they want. So it's pretty much development of this free market, which is probably, I think it's the main way how people now receive medical care. So they can come to physician and literally tell them, look, I want some IV fluids and I will pay for that, right? Or I want MRI of entire body, and physicians can order that, which is of course completely impossible in this world where we live, right? And then another big part of conversation is what we got from Soviet Union. I know it died 35 years ago, but some things are still linger. And one of them is reputation of vaccines. And I just have to tell you that situation with vaccines in Soviet Union was terrifying, since physicians didn't have any personal responsibility for vaccinations and for quality of vaccines. So just to tell you like a little view, right? Vaccines were held in usual kitchen refrigerators without any alarms, forget it. And if electricity goes off, well, too bad. They were transported in normal, regular boxes without any regulation of temperature. So as a result, of course, quality of vaccines, especially in villages and a little bit further from the center places, quality was poor, which means A, very poor protection, and B, it's a lot of side effects, right? So that's where distrust came from. I know in Ukraine in past 10 years, vaccinations were highest quality, things were getting much, much better, but we're still dealing with, memory. People don't have to trust necessarily. If they have personal experience or the parents had personal experience of side effects of vaccines. And another part of it that people here, especially those people who don't speak English, but even those who speak perfect English, still rely on Russian-speaking sources for information. And here, unfortunately, border does not really exist. Some of those people never arrived to the United States in terms of informational sources. So when we try to prepare all that wonderful information, if they're in English or if they are in news or they're in mainstream sources, it just has no chance to reach community. So that is another kind of historical factor. And right now, of course, you see catastrophic events going on in Ukraine. It's basically a genocidal war, and it disproportionately touches children. Right now, I mean, I don't know about right now, but a couple of days ago, when I looked at this information, 195,000 children were stolen from Ukraine and brought to Russia. So right now, basically what is happening, Russia tries to eliminate Ukraine as nation. So it's not just war for influence or political war. It's actually an attempt to eliminate Ukraine. And it's not the first one. We had similar attempt not so long ago, 1934, 1935, of Great Famine, where almost a third of population died in one winter. So when this war is happening, it's not a war. I mean, it is a war for independence, but it's also a war for mere survival. And right now, what we see here, we see two nations here, immigrants going through two different traumas. Trauma of Ukrainians is pretty obvious, right? When you wake up in the morning and first thing, like I already checked on my mom and I already checked on my brother. So, and you go to sleep only when sun rises over there already. So, okay, the night went through, okay. So this is, and of course, many of people lost somebody already, and situations that when somebody died and there was nobody there to bury them, or situations when people cannot contact their relatives for a couple of weeks. So all of that is amazingly high stress. Plus we have refugees coming, right? So, and refugees, right now I hear stories that I am myself not prepared to hear. And my worst story was coming from 9-year-old boy that I supposed to help, and I myself could not even comprehend what he was saying. When children arrive from, Mariupol or Irpin, Bucha. So that is one trauma. And another trauma of Russian people, and I cannot be expert in that. I'm Ukrainian myself, but from what I see, it's people who are losing their own culture, their own identity. Right now, for some of them, it's difficult to tell they're Russian. There is quite a powerful disconnect with their families who are still in Russia, and some of them cannot even speak to them, right? So it's losing connection with very core of identity of people. So I would not minimize that trauma as well. But as a result of those different situations, Russian and Ukrainian communities are split right now. And that's what we were trying to do in our webinars, is to separate those two communities right now, because it's just plainly too painful to be in one space. And I can talk much more about it, but I don't want to take our entire time talking about it. So, so this is all kind of happened outside of the United States. It's something that was outside of our control. And there are a couple of things in the United States still outside of our control, but those things that are very, I found very difficult to overcome. So first of all, I just want to tell about entire culture of medicine and patronizing tone that medicine takes towards patients, especially patients with lower education level. Somehow there is general idea that we know better, and we will tell you what to do with your kids. So I found that this attitude will lose any kind of hope for trust right from the get-go, right? So we are dealing with our vaccination charts. We have to do our job to vaccinate, but please don't disregard parents and how difficult this decision is for them. So when I opened my practice, it was the second year of measles, right? Like second year of existence of my practice, that's when measles hit. And we obviously had very large percentage of unvaccinated children. And I looked at just what happens to families. So in the beginning, it was just a question, what measles is? And for me, the very fact that people ask question what measles is a victory of vaccinations, right? So people did not see those diseases yet. So when measles did hit, we had many people come and vaccinated. Please, please, fast, I have 8 more children. Can we please vaccinate all family? And I had similar situation in residency when pertussis hit. And again, one person came to church, and then I had a line of people to treat, and then another line of people to vaccinate, right? So people don't know the diseases, right? But they hear all those horror stories about, somebody, I mean, you heard all those stories. Somebody died from vaccine, somebody could not walk, and so on. So parents take it very seriously. Right now, we do a lot of immigration exams, and people refuse vaccinations, even if they can be deported, even if they cannot get status. They're afraid of vaccines more than COVID, you heard that, because they think their death is much more likely from vaccine than from disease. So you're dealing with very scared people, right? With completely different informational bubble than that we're at. Then next one is like from barriers in the United States. Next barrier is that many clinics chose not to take unvaccinated children. And I don't know how situation is right now. So I wanted to ask if you please could show me, I think Tammy created a small pool, how many of you actually see unvaccinated children in your practice? Perfect, perfect. So I'm very happy to see the tide change, huh? So majority of you do, if not almost all, and some unsure, right? So I'm very happy to hear that, because when I left corporative medicine, the idea was, no, we cannot afford having sick people with healthy people in the same waiting room, and so on. So I'm very glad to hear that that's changing. But the idea that the very first attempt, if you remember, when we were limiting unvaccinated children, of course, those children lose any ability to be influenced, right? And their parents could not be influenced. So I'm glad to see that this is changing. Okay, and then next one is, of course, pain of many physicians is that we don't have time with patients, right? That hopefully it changed with new billing strategies and how we get paid for our work, but still very short appointments. And it's difficult to develop trust with somebody on short appointment, and continuity of care goes away. So I'm still taking shifts in urgent care in a couple places, and what I see that very often patients cannot get to see their primary care. So it can be a primary pediatrician or primary family medicine. So essentially medical care shifted to urgent care. And you can see proof of it by how many urgent care places open up right now, which means in the very critical moment, in the moment when people come to us scared and hoping for help, person who helps them is not the primary care provider. So we're losing the very golden opportunity to develop trust and to show that we're actually useful, right? Because I found that people are the most open for any kind of conversation is right after you were there for them in that critical moment, even if it's ear infection, right? Because we were there for them when they needed us, and now there is a way to hear maybe my thoughts about things. So, and then another thing that I found very challenging is pool system. I don't know how many of you have pool system in your workplace, but in our workplace, we didn't have personal MA. So for me, it was a challenge, just like for other physicians who had some cultural background and different language, because we had MAs that had to be interchangeable. So we could not even get a Ukrainian speaking MA. It doesn't matter how, that was two of us, two physicians, two providers, Ukrainian. So that is pretty much what I can see in general in the United States. And then of course, COVID disaster hit. And I'm talking about Ukrainian population, but I think it's true for Russian-speaking population as well. Disproportional hit by COVID because it's large groups, it's humongous churches. Isolation is a joke, like it's not taken seriously. So when you go, because especially if you pray to God, you know, there's no way you can have COVID if you came to pray to God, right? So large groups of people were sick very quickly. All those bridal showers, you probably, I don't know if you heard, but we had a devastating story here where there was a baby shower and actually the pregnant woman got COVID, was on ventilator, and she had to deliver kids while in coma. It was just devastating. But parents of her guests also got COVID and a few of them died. So that was a baby shower consequences, right? So this is one part of equation. Another part of equation is a source of information about vaccines from not American sources, let's say, right? And there are powers that are provoking anti-vax. I mean, you know all about it. And another part is mandate. I think that a vaccination mandate was a disaster in terms of both trust to physicians and vaccination rate, actually, for at least our population. But the most difficult part was that when nurses, medical assistants, and even physicians lost jobs because of vaccination, lack of vaccination, with that, we lost our last chance to talk to that community. And that was, I think, one of the biggest problems. How many nurses, like I know that Peace Health had, I don't remember exact numbers, but almost a quarter of nurses, Russian-speaking, non-vaccinated, that had to leave hospital. So now we kind of have this bubble and we have to reach another bubble and all bridges were burned. So that kind of my short overview of where we stand right now. And in terms of us, our role, you can see how little physicians are represented in media. How many sites exist with pseudo physicians, right? With pseudo cases. So people gain popularity talking bad about vaccines. And what are we doing? We're too busy with notes, right? Or we're too busy writing notes, or our management does not allow us to go and talk to news or talk like do YouTube video or something. So essentially, we as community are hiding physicians. I'm not saying it's our fault. I'm just saying that's how our system works right now. So for none of us, it's a great idea to leave our work and go and do free work, majority of cases, almost free, for publicity, right? So this is one issue. And another issue, unfortunately, in my community, people don't go to school because school in Soviet Union was also equal to government, and majority of people had to run from Soviet Union, and they equalize education to lack of faith. So this is also a big problem because we're disproportionately, there is a very disproportionately small group of Ukrainian physicians or Russian-speaking physicians here. So that is basically my overview of the problem, right? And in terms of how do we solve it, I don't know. I can tell you what I do. Some of that works. Some of that, actually, I was thinking when I was preparing for that, how many fully vaccinated kids I have in my panel. And I think I have 3 fully vaccinated children. So that's basically unheard of in my practice when child comes with vaccines. So every time we have to, start all over, all this conversation. So the way how we do that in my clinic, probably not very different from yours, but some might be. First of all, I do have a Ukrainian and Russian informational booklet that actually Washington State did. So thank you. Department of Health did fantastic job, especially doing both languages. So please, Russian and Ukrainian languages are different. And basically, if you're having a patient from Ukraine and you're offering Russian interpreter for them, you're losing trust right there. They will agree because they know Russian, but they probably would not prefer speak Russian. But that's just kind of like side note. So when people wait for me in the room, they can't take that booklet. And very often, especially during measles outbreak, I would come in and they're reading through that booklet and they immediately put it down. Like, I didn't do it. I didn't take it, So, and it kind of like provokes question, right? So do you want me to, like, this is your booklet, it's for you, but do you want to talk about it? And I would say majority of people will say, no, I don't want to talk about it. And this is very hard for me to put all brakes, right? All brakes and just say, okay, but if you have any questions, I'm here, I'm open, and I will find a way to make my time to talk to you. And that's it. And we close this conversation. And I found it very, very helpful because people will approach me usually 2-3 visits later. Actually, I do have a small question, and they bring me those videos about little Tommy who could not walk after Tdap, stuff like that. And at least we have some kind of chance to talk, because before people at least asked us, now they don't even ask us about vaccines. They already know, Google already told them everything. So that is one trick. And another trick, of course, time. When person asks me about vaccination, in my mind, time stops. Like, that's it. That's the most important thing I can do for them, is answer the questions, try to understand where my chance for influence is. And I personally try to separate vaccines, because I think one of problems is that we talk about vaccination against flu the same way how we talk about vaccination about polio. And I just separate for them. I'm like, look, if my patient doesn't have flu vaccine, well, I'm upset, but that's all. But if my patient doesn't have polio vaccine, I'm losing sleep, because it's very different disease. And we sit down and we talk and we negotiate every single vaccine. And I usually start with polio, just because it has very little side effects. And of course, it's a terrifying disease. And then I tell them, yeah, please have Tylenol, please have ibuprofen and all of it. So I prepare them for side effects that most likely won't happen. So people come back then, you know what? There was no side effects. We were waiting, but there was no side effects. And they're open for next vaccine. So that is pretty much what we're trying to do. And then media presence. I'm just trying to be everywhere I can to talk to my patients, or not my patients, but Russian-speaking, Ukrainian-speaking patients. Yeah, we do have hate emails, we have hate phone calls, but you know what? I still feel that it might make a difference for us to stand up and actually offer our guidelines and offer our evidence-based medicine, to at least have that voice present in media and social media. So that's all my thoughts that I had for today. And please, if you have some questions, please let's talk.
Thank you so much, Dr. Darich. Just incredible expertise and experience. We would love to take questions. Please feel free to unmute or put any questions in the chat. Did anything resonate? Anything you want to learn more about? I'll ask a quick question. Dr. Darich, you mentioned those pamphlets that you use. Are there any other resources that you use with your patients pretty regularly?
We actually do have, mainly we use your booklet. Oregon also has booklet, but we don't have it in Ukrainian language, and it becomes more and more acute issue. With every day it becomes more and more important. And I have to tell you the main reason why I use your booklet, because you have a page on how to differentiate true or not true information on internet. So when people say, oh, I don't need this booklet, I'm just telling them, you know what, there's one page that will pay for you to take this booklet. And I just show them that one page that actually I liked myself when I looked through the booklet. It was very well written. So I almost feel, and by the way, that's the only resource I found that has it in plain language, very well written. I actually have to tell you that's the main thing I use. And of course I use schedule all the time. So schedule, I mean, probably as everyone else here, you know, my schedule, I just got it a couple of weeks ago, but it's already looking like it's 100 years old, because every time we go through schedule, okay, that's when your kid has to have it. And yeah, so people asking about that booklet. So please, if we could put it. And I was wondering for both of this website link and link to that booklet, how we can order that. Maybe we can also email it. What do you think?
Yes. Yeah, I have the emails for everyone who registered. So we'll send out the slides, the booklet, and then the provider training as well. I do see a question in the chat. Vadim, go ahead.
Yeah, I was just going to speak to the book. It's called Plain Talk on Childhood Immunizations, and we have it translated in Russian and Ukrainian. So we can link that and you can order it from DAS if you need printed copies.
Perfect. And then Ludmila's asked, with these repeat visits with patients who are not vaccinated, do you continue to bring the conversation, or do you let the patient drive the conversation with their questions?
So I actually used to be a counselor when I was going through pre-med, and I was trained heavily on motivational interviewing. And I know you heard that many times through med school and training, but it's actually a phenomenal tool. It can be very, very short, I promise, 4 minutes, but I basically go for harm reduction. So when people open up, I treat it as a huge blessing from the sky, and I just listen. You know, and I'm listening until they're done talking. And initially they go aggressively because majority of people who are against vaccination, actually it doesn't matter which community, they go against us as enemies, right? And they finally break down that wall and they talk. So I just listen. And it's amazingly how quickly people stop talking when you just listen to them, right? And then I ask questions usually. So unless people directly ask me questions, I just listen and really let them drive, because my thought is not so much this conversation as next conversation, because I need to develop respect. This is one thing. Another thing, I need to know what is out there. I want to know how they think, where they get information. So often we just, you know, like with this little Tommy that you know, had problem with walking after Tdap. I'm like, okay, well, interesting. I wonder how many stories about Tommies who died from it, right? And we just had tetanus in Peace Health in Vancouver a couple of years ago, right? So basically having that said, right? And for me to collect those arguments. In the very beginning, I would write argument at home by myself. I would write argument and just brainstorm with myself how I can answer that, because they are ready for our evidence-based answer, right? Mainly like with that Tommy, what I did, we were going for source, and you cannot actually find source in majority of those videos. So you're trying, oh, I wonder how we can contact them to find out more information, in which clinic they got it. This is usually breaks and opens eyes, like, oh my gosh, really, there's no source, right? There's newspaper. Okay, so where this newspaper is, there's no phone number. I can almost guarantee you that you won't be able to find source. That is one thing. Another thing, very often I try to tell them, I tell them that I am personally responsible for my vaccines. In my case, it's my clinic, my refrigerator. If temperature goes up, guess who gets an alarm on my phone? It's me. So I have to go and do arrangement with surgeons to have my vaccines in their generators, you know, in the refrigerator that has generator. So I think this is more helpful to let people drive conversation. Yeah. Is it something our customer service case management should know? Well, yes. So in terms of what you should know to make more impact, right now you can reach Ukrainian community, entire refugee Ukrainian, not entire, but majority of them, probably in the matter of hours, if you know whom to contact. So IRCO, Lutheran Community Services, they have those contacts, and also pastors. So if you have a chance to develop relationship with your church, whoever is in your area, and those pastors care for their communities, but they really care about what community thinks about them. So I would be shocked if you'll convince pastor to be pro-vaccines, even though we do have few of them, 2 of them in Vancouver, that promote vaccination in their churches. But just having a relationship with them is important for us and important for them too. But not to come and teach them, but maybe to go to church and ask them, can we just do a study why you're not vaccinated? And they're usually very grateful for that. And pastors like to look important and have influence in community. So it's doable.
I have a question from Dr. Hassan that I think is something maybe a lot of you are wondering. Have you found ways to help patients understand why misinformation sources are unreliable, and how do you discuss this?
Well, you cannot really prove it to people because that's the only sources they have. So you cannot tell them, oh, everything you believe is not true because I said so. You cannot do that, right? So you got to have something instead. I basically tell them, look, you got to have 2 sides of story. If you cannot argue another side of story, then you don't know that side of story. But it doesn't go well with everyone. And I ask them to have different sources of information. My favorite is Voice of America. Voice of America exists in Ukrainian and Russian. It's based in Washington, D.C. It's fantastic source, I think. And BBC. So BBC, yeah, there is one from United States and one from London, but they also translate. So I just ask them, like, please get sources from different countries, and sometimes it works and often it doesn't, because it still will be YouTube videos, for majority of them. So here it's, I think, I'm not sure that we can solve it on our level, but I am very happy that some Russian channels right now are not allowed on TV, at least. So at least we have some chance to reach that that part of community that relied on that information. But really, we cannot just tell, oh, it's not true. People just won't believe it. Plus, it's large churches and they're connected to other churches, like let's say from Ukraine or Russia, and somebody had side effect in that church. And now, here people know that, oh my gosh, from this vaccine might be side effect. And actually they do think that, oh, high fever is a huge side effect. Well, if you compare diseases and one day of high fever is a small thing, that's probably not correct assumption, but they didn't see the disease. They don't know what to compare with. Okay, so thank you so much. So I think, are we out of time at this point, right?
We are. Thank you so much. We're seeing lots of amazing comments in the chat. Thank you, Dr. Darich. We put a 5-question survey, if you don't mind submitting, about the webinar, and then in the bottom, you can talk about other topics you'd like to hear about, other conversations to have. But thank you, Dr. Darich. Thank you, Vadim G, Irene, Dr. Tsiering. Thank you to this team, and thank you for joining this conversation. And it doesn't end here. We'll continue having conversations. We'll send those links out and continue working to support these communities.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
The comment, worth getting up early for. That's a good one. All right. Thank you, everyone.